Good day, colleagues. I am Sushil Salian, an HR professional focused in HR operation and strategy. Today, we have a very special guest with me, and his name is Dr. Darrell DeMello, a doctor who has treated approximately more than 6,000 COVID patients across India. So, why I am here with Dr. DeMello? As the lockdown starts and our employees will be coming back to the office, HR will be facing various challenges. Now, I am going to ask Doctor few tips which are required to be implemented once this unlockdown starts. Doctor, please give us few tips. Doctor, my first question to you is, what are the things an HR should do after the start of unlockdown?
Okay, the things, first of all, thank you for that question. The things that HR should consider is to put SOPs in place, standard operating procedures in place. If they do that, some of the key aspects of the SOPs are maintaining the social distancing in the office. Very important that social distancing is continued to be maintained. Wearing the mask at the desk is probably not required, but in common areas, absolutely wearing a double mask is required. Okay, so this is something that suggests. The other thing that suggests is putting in places where eating, not sharing other people's meals. Okay. Washing your hands. Again, very important to wash your hands. Checking the person's temperature as he or she comes in and when they go out. Check the temperature and see what the temperature is like. So these are some little things that can be of importance to make sure that your employee is safe. And if they are ill or they have any fever, that they are then identified and either asked to go home or go see a doctor or see one of us to see how things work out. So this is something that can easily be done by HR. Okay. The other thing would be is to ensure their well-being, their mental health. Okay. Many of these people have lost family members. Due to the COVID disease, many of the employees would have lost a father, or mother, or brother, sister, somebody, aunt, uncle, somebody. They've gone through certain trauma. Okay, so you want to make sure that that trauma is taken care of. So if they have concerns, okay, have a counselor. Have a counselor who they can talk to. Or have a HR person in the task force, in the COVID task force. I'm sure every company has their own task force. Okay, one of those members must be allocated to deal with such employees. And those numbers can be shared with employees, and employees can happily talk to that person in confidence and share their concerns. Okay? Coming back to office is not going to be easy. After you spend time at home for a year and a half, now coming back to office is going to be a challenge for some people. Okay, because suddenly now you haven't met your colleagues in months and years, 1.5, 2 years. You've got new colleagues to meet. Okay, you've got now to re-establish those personal relationships. So a lot of things you, as HR, the HR professional, can actually implement some very simple techniques and procedures in the office to get that bonding together, to get the happiness together, to get that employee thinking differently.
Thank you, Doctor, for your time and this points which will definitely help the HR team to implement the things which you have told once the employees coming back to the office to develop. Thank you very much. Thanks for
Appreciate it. Thank you.